Recording will be posted by Peace, and I also said she could share the slides. So, good morning. My name is Henna Sawhney. I am a neurophysiologist. I work in surgery, so I do neuromonitoring for surgical cases in such as in neurosurgery, ENT, vascular, and others. Um, I've been with TIMGA and Muhammad, specifically Muhammad Khalif, and I have been colleagues for a number of years. And I've advised many people on these alternative licenses and getting into residency. So today we're going to talk about three specific things. That will be the alternative licenses, how to network and gain good clinical experience, and then how to interview effectively. The goals for this webinar are how to figure out the best pathway for you. So that may be an alternative license in another state, or it may be to continue pursuing residency and eventually practicing, or it could be finding another clinically adjacent job, whether it's in research, public health, or still in the clinical field, but not actually working as a physician. Um, and in order to do that, you need to have good clinical experience. So I'll explain what good clinical experience are, what are the opportunities, and how to obtain them, and then the pros and cons of each. And lastly, once you have all this and you know your plan, how to use your experiences and actually interview well to get those jobs and move forward in your career in whatever path you decide to follow. So we'll start first with alternative licenses. So right now there are 18 states that have some sort of alternative pathway for licensure. And this is either a limited license or a pathway to full licensure as a practicing physician. Some example states are Missouri which actually was the pioneer in this, which was the assistant physician license. I myself worked under that license in urgent care, and I know a number of my colleagues matched into residency, and some were able to find a path to full licensure without actually pursuing residency. Washington has the most novel license, which is the MDCE license, which a lot of people have gotten and are currently practicing. And just last month, we were able to get a bill where there's a pilot program to actually get to full licensure. Um, Texas is also the most recent state, other than Washington, and Oregon is another one where they have two sets of licenses. One is for those that have completed a residency, and one is for those that haven't. So overall, the general eligibility requirements are going to be the same as what you do need for applying for residency. That's going to be step 1 and 2, definitely in your ECFMG certificate. Some will require step 3 because step 3 is the final exam to get you to full licensure. So if there's any pathway to full licensure, you're going to need step 3 either before applying or eventually while you're in the process. They're going to verify your medical education and some your medical training if you've completed a foreign training, and that is usually through the FSMB and their FCBS services. There are some special requirements where they may need like proof of completion of your residency training and like a certain number of years of training. Or you need to provide proof that you've held a full and unrestricted medical license in another country and practiced for a number of years. I'm just going to switch screens here real quick to show you. So FSMB has a list of all the states that have some kind of limited license. As you can see here, they also have the status, if it failed, like the bill, when it was introduced, if it was enacted, if it went through, if it's proposed. And so you can look at this directly and see if there's something in your state that might be in the process or introduced this year. And that's also really vital. Like I am currently in California and we're working on something here, though there's a little bit of resistance. So we'll see if we're able to get in California. But there's a number of states that are working on getting this, and it's become more and more popular over the years. That's for sure. Um, All right. So that's a general overview of these states and their licensure pathways. Um, so why would you even go for an alternative license? So, an alternative license is a structured clinical experience and it's in the United States, which is important for both applying for a residency, but also if you want to be practicing in the United States eventually. For residency applicants, it's that proof you need to that you're clinically competent, and it's also a good way to get strong letters of recommendation from American physicians that can vouch for your clinical competency because you're working directly with them or they're supervising you. And if they're supervising you, that's very similar to what will be happening in residency. If you no longer decide to pursue residency, this is a great path to actually practice medicine and be paid. Otherwise, what a lot of people struggle with working adjacently to medicine or they end up paying thousands of dollars just to get clinical experience. And residency is already a very costly process, and adding more costs to it is just really difficult for people that don't match into residency. So these types of routes are very important, and they're expanding. And I think it's better. It's been better over the years for Unmatched to get these kind of experiences and to stay in within the clinical environment, without needing to you're kind of in limbo otherwise while you're applying for residency. So the first license that I talked about that a lot of you are probably familiar is the MDCE license. This one, you'll need step 1 and 2, and you work under supervision um, for 2 years. The license is valid for 2 years and can be reviewed up to 4 times for a total of 8 years. And now, just as of this year, there is a pathway to full license, and you do not need any verification of having completed a foreign residency. This is a very new pathway and unique to only Washington. So if you haven't already or you're currently working, this is one of the great, I think it's a really great opportunity for people that are not matched into residency to be in this kind of environment. There are a lot of jobs available. It's just it just depends on what you're looking for. Are you looking to work in primary care, which is probably where this pathway to full license will end up, or if you want to specialize, which would mean probably still applying to residency in some form. Illinois also has a new IMG license. This was passed just last year. This requires up to step 3 because they want to uh, make sure that you've completed a foreign training, like that you're ready to be a full practicing doctor. And they also required that you've had an active license for at least 2 years within the last 5 years. You have to have proof that not just that you've attended a residency or postgraduate training, but that you've completed 3 years of training. You first work under supervision for 2 years, and then eventually you get a path to full medical license. Also, if any of you have any questions, please feel free to put it in the chat, um, and I'll try to get to them as I'm going through. So next is the Iowa IMG license. This is also something where you work under supervision for 3 years and under a provisional license. You need to have proof of 5 years of clinical practice in a foreign country. And it's the same. You need a step 1 and 2 ECFMG certificate. And finally, Texas has an IMG provisional license. So this requires step 1 and 2, of course, ECFMG certificate. You need only proof of 6 months of medical practice within the last 2 years. Um, and you need proof of a residency or postgrad training. If you haven't completed certain exams or the residency wasn't approved by a foreign body, you need to complete a clinical competency exam. Um, you'll work under supervision for 2 years, and then eventually you will get a path to full license. So this is just a graphic of proposed or pending legislation. It's similar to the FSMB page I had, but it's more visual here. These are they're different types of license there. They're limited licenses that have time constraints on renewal, like what the MDC license was initially, where it was only valid for 4 years, where as we in Washington, they then proposed a new bill which got it up to 8 years, and then finally now a path to full licensure. There are many states, as shown with like Texas, Illinois, and Iowa, where there's a path to full licensure if you've already completed a foreign training and have proof of having an active license and having practiced under that license. There are also temporary licenses or permits, like in Arizona, where they have the temporary training permit, and that one is a little complex because it requires proof that you've applied to residency to keep that license active. So, essentially, that is for people that are looking to still go into residency but need some kind of clinical experience. I know a number of people working under it. Some people like it, but it's still, um, if you keep going unmatched, there's not much, and you decide not to apply for residency, that's when it's no longer a valid pathway. All right, so that was the alternative medical licenses part of this webinar. Does anybody have any questions or comments about the different states that I discussed and the requirements? Okay, I'll take that as a no. And we'll go on to the next part, which is networking and gaining clinical experience. All right, so networking. Net Everyone I've advised over the years at TIMGA always asks, what can I do to get into residency? It's always like, should I get another degree? Should I do this? Should I do that? Everything someone tells you, like doing research, doing all that, you can do it, but it's not the thing that's going to get you into residency, really. The biggest thing that I have seen that's common is people that have networked efficiently. Unless you can get through those filters with a good score, or you have some kind of art. Really, it's a connection to that residency program in some manner. Whether it's you met the program director before the match process started, and they really liked you and they offered you an interview, or when you got that interview, that resident director and people on the staff really, really liked you during that interview, or you attended a conference and you met someone. It's all networking. Networking is the way to get your foot through the door if you're not getting interviews just on your application. And the reason you're not getting interviews on your application is because of the filters. It's not because you're not qualified as a physician or qualified for residency. It's because somewhere you just don't meet that threshold and then your application just doesn't get seen. So that's why networking is really important, because your application can just go unseen year after year as you apply. But the minute you get someone to actually get eyes on your application, and that's when it'll make a difference. And that's why networking, I think, is the most important thing for getting into residency as an IMG. It is not only scores or research. You can have the most stellar application, but if you are not networking, it that is the biggest thing, that's the thing that will get you through. Even if you have a red flag, quote unquote, or if you have something that's people say is the reason why you're not getting into residency. Because once you get that person to like you and they want you, that's what will make the difference. And that's what I say is pleading your case. When you meet someone, you're describing your experiences and you're selling yourself. It also, networking gives you the opportunity to get a clinical experience with someone, like have you can shadow a doctor, maybe they have some research you can work on. And when you work with them, that's a personal way to make an impression to get you those interviews for residency or even another job. So the best ways to network is, if you're like an example, if you're applying for family medicine, AAFP has their annual conference. Same with ABIM. Every specialty has a uh, annual conference. If you're unable to present a research or anything like that, at least attend. Attend and then network with residents at programs, network with resident directors or other staff, or just go to your local chapter event. Knowing having that and like networking and making those personal relationships and or personal as in professional personal relationships and actually having face-to-face contact is what will make the biggest difference. You can also do the same with former classmates or graduates of your medical school, whether that's contacting them through your medical school or searching them on LinkedIn or Doximity, see where people from your medical school are practicing or if they are practicing, um, or if they're in residency currently. Some people are willing to help, some are not, but it doesn't hurt to try. Last is what I call a cold call. So that means just like showing up somewhere and trying to get a position. I did this in high school where I wanted a volunteer position and I just called a volunteer line and I just talked to them and I had missed the deadline to apply and they were so impressed by me. They were like, "Okay, we'll allow you to apply," and I got the volunteer position. So that's why I say impression is the biggest thing. It's and networking and in person. With this shift to virtual and like looking at applications and not actually getting a chance to see the person behind that paper, it makes there's a lot of talent out there like you guys that are not getting seen. So that's why I say like plead your case, find network as much as you can. It's exhausting. Do what you can though, because eventually it's kind of just like knocking on a door until one opens. And that's really what happens when you go unmatched. And a big part of it is not just that, it's luck. Um, if you are lucky enough, just because of it's a lottery system, the way it is. And there's no harm or foul if you don't get it. But if you are committed, it can either be quick within 2 to 3 years after graduation or your first couple years of applying. I know some people have taken 10 to 15 years and they kept applying and got in, which is a lot, and not a lot of people can do that and requires a lot of mental strength to get through. But it's if you're applying for residency, that's what you have to do. But these same things can be applied for getting clinical experience jobs as well, especially under these licenses. So why is clinical experience important? So the most important thing is that it assesses clinical competency. Like, can you practice? Are you good with patients? Do you know what you're doing? It is an indication for if you're ready to practice as a physician, and it's really important for strong letters of recommendation, which can also tip the scale in your favor for residency when you get interviews. And this can also be used to offset red flags such as low scores or any attempts or anything like that, because those are just one piece of the puzzle. It doesn't matter if you have a low score, if everyone's saying you're a great doctor and they've seen it with their own eyes and can vouch for you, and they have clout as a physician working in the field. So I'm just gonna pause here. Anybody have any questions about what I've just said about getting clinical experience and networking?
Hi, I have a question, Dr. Sawhney.
Yes, go ahead. Sorry, I can't see who is.
My name is Solomon.
Okay, there you go, Solomon. Yes, go ahead,
Yeah,
Solomon.
thank you. So my question is about both clinical experience and networking. So I'm currently residing in Washington and interested in pursuing the Washington Clinical Experience license, MDCE license. But apart from all those requirements for, USMLE Step 1, Step 2, and the application, the another more important part is finding a doctor that'll actually be willing to supervise you. Is there a path to like network for this or facilities that TIMGA has experience with that would be preferred or we should make priorities to reach out to when applying for an MDC license?
Right. So this is common. It's not just you. Everyone is having difficulty. So the first is you have TIMGA as a resource, so you can always email Peace and ask if we as TIMGA have any open positions and are looking to hire. Peace also has been really great at posting when we have a clinic that is interested. She's posted a link for everyone to apply, and then we kind of liaise with these clinics. When we first started this license, the way people got this job was they strategically applied on LinkedIn, sorry, not LinkedIn, Indeed. And I did a webinar on how to apply for the MDCE license and the application. There is a recording of that that goes into more detail, but pretty much what it was we at TIMCA have a cover letter that explains the license, and then I say attach your own cover letter right under that cover letter that explains your qualifications as a physician and have a resume ready, and then apply for clinics that have about 4 to 6 doctors working there. Like look for those kind of clinics and apply on Indeed for nurse practitioner or physician assistant positions. The thing is, this is still a relatively new license, so some doctors have not heard of it at all or are a little skeptical about using it because they don't know much about it. So we have already relationships with clinics. TIMGA has a relationship with clinics, and we can try and get provide you that information whenever it is available to you. If not, that has been the most effective. And actually, the first couple of people that got the license was not through us. They got it themselves by applying, as I said, on Indeed, for these nurse practitioner, physician assistant jobs, because that's the same scope of practice you'll have with that license. Um, I've also told people that if you're living in Washington already and you see any doctor's clinics in your area, call them up and say, hey, I'm looking for a position. Like some doctors are very impressed when you advocate for yourself and you need to, the problem is when you're in this position, you have to really step up and have that confidence. So you can call clinics, or if you find an email, or if you have any other, if you know of any doctors, like your own primary care physician, if you're living in Washington, asking them if they know of any doctors that might be interested. Or maybe your primary care physician works in a small clinic, and they're able to talk to their, medical director or something and hire you. It is difficult because this is a relatively new license and it's gaining momentum, and a lot of people still don't know about it. But what I've heard from people that have applied on Indeed is within 2 weeks they've gotten an interview, which is, and then some within a month or two they're working. That's the quickest it's been. So it's it is a little difficult, but it's not as difficult as residency, where you're waiting a whole year and you have no control over the process. Um, but your first and biggest advocate will be us. So you can always ask Peace or someone um, for email Peace, and she can get back to you on behalf of us if we have anything available. Does that answer your question?
Yes, that answered my question perfectly. Thank you so much.
Okay. All right. And that's the same for if we have any other resources available, we try to spread the word out to you as quickly as we can. Um, so just have these things ready, because in case, let's say tomorrow morning, Peace has something and she posts it on the TIMGA chat, you have to apply. It's a very short window that we have for the application because we do it on a first come, first serve basis. And then we just hand over the applications to those clinics, and then they review it and process it in their own way. Um, so have a cover letter ready and a resume ready that shows you're ready to practice, um, and that what your interests are. All right, so that's clinical experience. So now, what is clinical experience? And I saw it was Hannah in the chat um, and I will get into those exactly. Um, So your question is all on these next slides. So clinical experience, it varies. And some residency programs will say this is clinical experience, some will say it's not, but honestly, they all are. It's just a matter of if someone, if the person, the residency director or the the team that's interviewing residents, if they agreed on what is clinical experience. So there's the traditional core rotations. You have internal medicine, any subspecialties, specifically neurology and cardiology, surgery, psychiatry. Some do ICU and emergency medicine. Some schools don't. Outpatient is all primary care. We're going to be it's adult medicine, pediatrics, OB-GYN. And these are usually 4 to 6 week rotations. You can, there are, and I'll get into these, there are some companies that provide these rotations. And then you're adjacent to medical schools and residency programs. So that's like, again, it's almost not even the rotation, but it's that opportunity to network with those residents, with that residency director, with those physicians in those residency programs. That's what these rotations are doing. Um, it's and proving that you can work in the medical system, you're a competent physician. Everyone's like, oh, it's just the clinical. No, it's not just the clinical experience, it's that clinical experience with the networking. Because you all have clinical experience. You've all completed medical school. You all have, it does not matter where you practice in the world. I had clinical rotations in my medical school abroad, and I had clinical rotations here in the US, for my third and fourth year of medical school. There is no difference in clinical practice and experience. The main thing about getting this clinical experience is the networking, getting face to face with those physicians at those residency programs. Where if you work under them and they're like, wow, you are amazing, we need to hire you as a resident, and you tell them you're applying, and then you kind of get an automatic interview because of that. That's what US medical students do, is when they have their elective rotations, they go and do rotations, not because they need to do a rotation, but because they can do a rotation at those programs that they want to apply for and make an impression before the residency cycle even starts. And so they're on their radar. So that's core rotations. Next is observerships. I do not like observerships because you cannot do anything. You do not have a license to practice, so you can't even examine patients. You can't take a history from them. You have to be just a fly on the wall watching the doctor. I did an observership once for 2 weeks, and the third year medical student was doing everything, and I was a graduate, 1 year out of medical school, and I couldn't do anything. And so was like whispering to her what to do because she was still in her first or second rotation, didn't know what to do. And I knew what to do, but I couldn't because I was just watching. And these are usually on a volunteer basis. Some say they're a rotation, but they're really an observership. But a rotation is hands-on experience. An observership, you're not doing anything. You can even do this with a clinic, like a local clinic. But now the need for observerships is a lot less with these clinical experience licenses and these other licenses in states because you can work with that doctor directly. Next, we have clinical jobs. So a lot of people do these clinical jobs. They work as a medical scribe. I myself worked as a scribe and a research coordinator and was thinking of becoming a medical assistant, just something to stay in before I got my license in Missouri. This is good in a way because you have a paid opportunity. You're not paying to be in that hospital, and you're not just paying to stand and watch. Um, Medical scribe is great because you are writing notes and but now with AI, a lot of the medical scribe stuff is kind of obsolete because a lot of doctors just record it and they can just get it into the EMR that way. But I do know some people that are still working as medical scribes. Clinical research coordinator is great because it's kind of a loophole where you can still, what I saw when I was working, especially because I had my MD, I could kind of examine and take a history from the patient and review their chart and talk to the primary investigator to tell them like what's going on with the patient, and you can discuss the patient's care. Um, and it's really like it's a really great way if you like research to get into research at an entry level. Um, you do have to kind of dumb down your resume because you don't want to look too overqualified. But getting into these is really great to get that experience. A lot of people work as medical assistants too, but again, it's you're kind of doing blood pressures and vitals and those kind of things. You can learn from it. But here's the thing again. It's not working in these things, it's the networking again. When you're a medical scribe, you're not just going to go and type up the doctor's notes. You're going to talk to the doctor. You're going to ask them, "Hey, I saw you did this during the patient encounter. Why did we do this over this? Why does this make sense?" Like you ask them questions, you engage with them about the patient's care outside of your scope as a medical scribe, and you talk to the other doctors there. And that's how you get the good letter of recommendations. And then maybe they know some residency program and get you, try to network for you or advocate for you to get a residency interview. So again, experience is great, but the biggest thing again is networking while you're doing this work. I can't stress it enough. I think there's a lot of shame in not getting into residency. You guys need to get, I hate to say it so harshly and bluntly, but get over it. And when I mean get over it is heal through it. And then advocate for yourself and use your confidence to network with these opportunities. And then finally, the best clinical experience and the best opportunities right now are these alternative licenses because you're actually practicing, you have a license, you are prescribing, which you did not get to do unless you've done a residency, but you in a foreign country, you did not get to prescribe in medical school. It's paid and it is extremely similar to residency because you are supervised by a physician. You are taking care of the patient, but at the end of the day, you have to discuss the care with an attending physician that is overlooking your work. And that's where you get, like, if you do, even under these licenses, if you decide, okay, I still want to apply for residency, this is what will make the difference is that you're taking care, you have full responsibility of this patient, but you have someone that has responsibility above you that you can discuss and like show your competency and work through these things. Um, all right. Any questions about what I just said? Okay. No questions then about clinical experience or networking or anything like that?
Just a quick question about those. Um, I've worked both as a medical assistant and currently working as a clinical research coordinator. Is there a weight to those when you apply? Should you prioritize one over the other? Do residency directors have a priority list of which ones have more value?
No. Um, if it's a research residency, if the residency program engages in some sort of research, you want to stress there's clinical research coordinator role because it shows you have experience, and that means you'll engage in research as a resident. If it's a outpatient, not sorry, not outpatient, if it's a rural residency or, a primary care residency in some way where it's where they're not really with a big hospital, it's a smaller hospital, community hospital, both will count towards the experience, but there's still not a lot of weight to those experiences. Um, because you're still not, you're not on the medical clinical side. You're clinically adjacent still. Um, you like I'm not saying that these are um not valuable experiences and good experiences, but they hold a lot less weight than a core rotation. Um, and that's just the reality of it because they're like they don't and a lot of times they don't know what you're doing. And as a medical assistant, you're still not doing a lot of the like as a physician, you're still going to be thinking about that, right? You have an MD, you're still going to be thinking about the patient and like doing things, but your scope of practice as a medical assistant is still very limited. Um, so it depends on what kind of program you're applying to. Um, like I said, so like the smaller community hospitals, they're just looking for good experience, and I feel like these alternative licenses are a little better because it's showing you're kind of working as a resident already and you can handle it. Though it can also backfire because some residency programs are really weird about these licenses and they think that you are not trainable then because you're already working as a doctor, so you won't listen to authority. Though there are fewer residencies like that now, but there are still some where they are against it. And then there are some residency programs, like believe there's one in Arkansas that hires people slowly, that have, I think like 90% of the residents are now people that have used some sort of alternative license, specifically the assistant physician license in Missouri. Um, so it's a good way, I think, like if you don't have that opportunity to work as an alternative in an alternative license, it's a good way to be paid and be close to residents, like to medical practice. But it just depends how you spin it based on the programs you're applied to. That's really the basic thing. But the bigger things out of that is the networking. Um, because I know one person, like I've known people that worked under that ended up being the primary investigator for them was someone that was either the residency director or the associate residency director. Um, and that was what got them an interview because they were working with them for a year in research. Does that answer your question?
Yes, that answers my question. Thank you.
All right. Any other questions? Okay. So now we'll go into gaining clinical experience. So this is for those paid core rotations. A lot of medical schools have a program like if your medical school has connections where it's like the Caribbean schools or like my school where you do rotations in the US. Um, there's a VSP service which you can apply for, but it's usually while you're in medical school. There are hospitals, like if you look at their website or certain departments, they say apply for a rotation here, and you can apply directly through the hospital website. AMO Rotations is a big company that does rotations across the country. Um, there is also resident medical, but I do not recommend resident medical at all, and I would steer clear of them. They cost a lot of money, and they say they guarantee you residency, but there's no way you can guarantee a residency. So I would steer clear of them. AMO rotations, do small 4 to 6 week rotations. Project IMG also is starting their own rotations. And then TIMGA has provided some opportunities in the past for rotations. The way to find them is a Google search, but these are generally the ones you'll find. Reddit is a really good resource for this. You will find a lot of people talking about those programs and where they rotated, how they got that experience, if they liked it. Um, but the thing is, these again, they cost a lot of money. They can cost anywhere from $2,000 to $4,000 for a month rotation. They don't, most don't provide housing, board, or travel, so you have to go there and like rent out a place or something like that. So it's very, very costly, which kind of is a gatekeeping method in a way. Um, but if you don't have opportunities like that, these are good ones. Actually, I'm gonna put in the chat, which I didn't put, but this is a volunteer organization that I worked with. Um, Let me see if I can get their one sec. Let me get the website for them so I can show you that website. I volunteer with them and they provide free care across the country. And 60 Minutes did 2 segments on them. The first time I saw them was in 2008 when I was in high school, and it was like amazing, but it's kind of unfortunate they're still needed. So this is a remote medical. If you go to their volunteer thing, you can register to volunteer, and they should have, yeah, schedule. So these are the places where they're holding on this map where they're holding clinics, and you can see the dates. It's a weekend clinic, usually starting Friday, ending on a Sunday. And you actually get to, like, it's like a rotation, but a weekend one, and you're providing free care. There are doctors there. They'll like say, okay, we'll take responsibility for you, and you can examine the patient, take a history from them. They have like a little, it's all paper, so you just fill out the sheet for with their information, and what they came in for, and then the doctor prescribes anything. They take some blood as well there. I really liked it. It's because you're practicing medicine in its truest form. There's no insurance to go through. These are people that don't have insurance. You're just providing care, without having to go through all those barriers. So I highly recommend going to them. But again, you have to pay your way there. Everyone does. I flew, I think, to like 6 clinics one year over a weekend. Um, from LA to Tennessee. There was one in Maryland and Baltimore, Virginia, and then Nevada. Um, and they have some that are regular. The Tennessee one in Knoxville, usually in February, is the biggest one. And I think one time we provided, when they did the cost, provided like $300,000 worth of care in one day for patients. And it's really fulfilling, and I think it's really humbling to see these patients. Um, so I highly recommend um, that if you're looking for some volunteer thing, kind of getting out of, and it's like a different perspective, and it's something you can really write about in your um, personal statement as well, because it's a different experience. And you can also look on what's it called, on 60 Minutes website. You can see their interview with them from like 2 or 3 weeks ago, and then from 2008. And I think Ram has linked it too, so you can see what it's about. So that's a really good volunteer experience that you can put on your resume and write in your personal statement. Um, but yeah, these are the main ways for gaining clinical experience. Like I said, a lot of it is paying for it. But you're not really paying for the experience as much as you're paying to network directly with those residency programs, which you can also do with other jobs, like, applying as a clinical research coordinator at a hospital near you, that has a residency program. Because most likely you're going to be doing research with someone that is on the residency uh, team that's going to be interviewing you or doing that. All right. Any questions? Okay. I'm gonna just hop off just for 5 minutes. We're gonna take a 5 minute break. If you guys need to get water or anything, go to the bathroom, and then we'll jump into the last segment, which is the interview preparation. All right, so we'll say around, well, we'll do it 8 minutes, so around noon. Just be back on so we can continue. And if you have any other questions or anything, you can feel free to put it in the chat, and I'll get back to it. Um, yeah, so for RAM, you don't need to be licensed. That's why it's great because you can work under a doctor that is licensed. But after the break, I'll answer any other questions, so feel free to put in the chat. All right, be right back. All right, so I just put a couple of the links that I already discussed, the FSMBs with state licenses and also remote area medical or RAMS link. And like I said, you don't need a license for that because you'll be working under supervision of a doctor for the clinic and whatever they allow you to do. A lot of medical students go with their medical schools there. But I went and like I even met some doctors and talked to them about my experience as an assistant physician in Missouri at that time. So, um, and if you know, if you're, I mean, if you, I also tried to get a clinic in my area with them, a free clinic. So they have, if you know of an, or you live in an area where there's, not a lot of access to care. It's a very rural area that if you live in, they go to those areas and provide care over a weekend. And they have ways to work it out. If you're bringing the clinic over, they bring all the supplies, they get all the volunteers, but all you have to do is provide, a space for them to hold the clinic. Um, and then they say, and also we get donations for food for the volunteers. So while they're there, they don't have to leave the site for a break or anything. Um, and that's kind of it. I think it's a great organization. I've loved volunteering with them. All right. So we're at a little afternoon. So this next part, interviewing is the key. Like once you get that interview, now how do you make yourself stand out? All right. So, there are different types of interviews. There's the formal, informal, situational, directive, non-directive. Um, So usually you'll have a formal interview where the program already has questions, or the clinic, if you're doing an alternative license, they already have questions um, that they want. With clinics, for these MDCE license, it's probably an informal interview where there's not really a procedure. They're just kind of there to get to know you. Um, they may do it virtually or have you come in on site to the clinic. Um, When I applied for assistant physician license, my interviews were a mix. First, I had a phone call, and then if they liked me on the phone call, then I was called over to like shadow for 2 to 3 days. Um, and that was to get to know the other assistant physicians, and then they would recommend if they liked me, and then an offer came. So it can be a combination of that. Residency programs will do probably directive or situational, along with formal. Um, the situational is because they want to see how you respond and like think on your feet for like certain situations that you will encounter as a resident. They may even have a session where you and the other interviewees are in a room, like in a fishbowl essentially, and they're watching you and they give you a task and they see how you work with each other. I had a colleague that did that and said it was a very weird interview. Um, but they approach it, every residency program approaches it differently. So when you, regardless of whether it's for residency or an alternative medical license or even a job as a clinical research coordinator or anything, you need to consider how you're presenting yourself with whether it's virtual or an in-person interview. Kind of get assess. They can sometimes will tell you, sometimes they will not assess what kind of interview style it is, and then see if it's just like one day interview for 1 or 2 hours, or if it's a course of several days, or sometimes several weeks. Residency interviews have changed, especially post-COVID. So before COVID, you would go there for like 2 days. One day, first day or half day would be interviews. Then you would go and like kind of rotate, you could say, on site with the residents. And then there would be a kind of panel where they would have doctors there for you to ask questions about the residency program. And then there's a social. And then the next day is another thing. Um, so that really depends on the residency program and how they do it. For co during COVID when we were interviewing, they did it kind of similarly, but without the social part. But you would have structured interviews where you're interviewing first with the program director, associate director, a resident. things like that. People involved in the residency program directly, and then there's a then they go over like do an overview of the residency program and like tell you where they're located, what they're doing, have some interactive stuff. But again, regardless, your strategy is going to be the same regardless of what type of interview it is or what you're interviewing for. And the best way is to have 2 to 3 experiences that from your medical school or any training or any patient encounter that you can highlight your skills. And then you can use those examples to answer questions in different ways. Also, you're all you need to practice, practice, practice. Once you're comfortable enough that like no matter what question comes, you can take those experiences and spin it to answer that question, then you're ready. Then you don't then like I practice so much with that I use those same examples to date for interviews. Um, and it's just ingrained in me to think that way. And but I still before an interview, I'll think through, okay, what do I want to highlight? Is there anything else I can add from my experiences? And then think about that before an interview and practice that. You can have friends do it with you, somebody that will give you good constructive criticism so you get better. That's you need people that'll give you honest opinions, not just say you're good and that's it. You need somebody to kind of nitpick those things so that you get better. And I feel like those friends that can be honest with you or those advisors, they're that'll be the most helpful once you do get figure out how you want to approach an interview. All right. So interview practices. Um, there's different things. There's a couple things specific to virtual versus in person, but in general, it's really the same approach regardless. Okay. So the first one is for virtuals, for virtual interview programs. So let me see if I can do this. So if I were to share, okay. So you see, oh, that is not what I wanted to do. Let me see. Let me try again. Okay, you can't see it. Never mind. Okay, but you see how on your screen you have if you look at all your if you're looking at like my box where I'm talking, if you place my box right under your camera and we're doing a camera interview, that will help you give the impression that you're talking to me, like you're making eye contact with me in an interview. And so that's kind of things you can do during when you're having these interviews to give a little better rapport when you're and a present a more confident presence on your interview, even when virtual interviews are very like they're a little weird. Um, Whereas in person, if you want to make good eye contact without actually looking in someone's eyes, you can look at their ear. So you're looking at their face and they think you're, oh, this person's like, engaging with me, but you don't have to feel awkward that you're actually making real eye contact in their eyes. That's kind of what the difference is between virtual. With virtual, also you can keep notes or cues on the screen to help you. My one of my friends did that. She had it just above her camera. So um even though if she was looking at her notes, it looked like she was looking at the camera. And it didn't, her eyes weren't moving off screen or around. And especially for virtual interviews, you need to have a quiet space where you have proper lighting and good internet connection. So in person, again, that eye contact thing, and then, positioning your body language is going to they're going to assess body language a lot. So if you're feeling closed, if you're looking like you're closed off, like you're tense, so like feeling relaxed, taking deep breaths before the interview, angling your body towards them with your seat in whatever way you can. So it looks like you're engaging. Those are all methods that really help with creating a good, like having a good interview. Okay, and so finally, so now these are the general best practices for interviewing. You should always be early, arrive early, log in early. It's better to be early than late in these instances. You dress to impress. So even if it's a virtual interview, dress up. Uh, Try to like sometimes some people play with a filter so their makeup looks better. Whatever you need to do to look your best. I was told when I was interviewing for residencies, like, wear for women, you can wear necklaces. I don't like necklaces because that's taking away, um, it's, the focus should be towards your face. So earrings, like wearing some earrings that are unique, but not too flashy, that kind of like stand out. For men, it can be a tie or something like that, that kind of, and it's also something that like you can talk about. With like if it's something interesting. Like I'm really into Harry Potter, so I wore Harry Potter earrings and I've been asked about Harry Potter, if I like Harry Potter or not during interviews, just because of that. And then that kind of makes me stand out because they're like, "Oh, that's the girl with the Harry Potter earrings." Even if they don't remember my name, it's like, "That's the Harry Potter girl." These things really do work, because people remember you by association. Before answering any questions, um, when they answer the question, pause for a second or two. Um, this helps calm you, and you can take a deep breath before answering, and then also collect your thoughts and how to answer the question best. So, some people just do one Mississippi, two Mississippi, and then at three Mississippi they start talking, or you take two deep breaths and go into the question. Before go before the interview, research the program or the clinic that you're interviewing with. So if you are able to get their information online or some way, um, find out who's in charge, who are the staff there, what kind of patient population they treat, um, what like if it's a residency program, if they're involved in research or any volunteer or something unique to that program. For clinics, looking at the area that they are, like for alternative medical licenses, like MDCE, looking what population they serve and where the area they serve. Um, Especially like if they do something unique or if there's some community organizations that they are involved with. This will show your interest in the program. Okay, and then finally, the way to answer questions is the STAR method. The STAR method is it's acronym for the situation, task, action, result. 95% of questions can be answered using the STAR method. So they'll say, "Tell me about yourself." You can talk about yourself. You can say, you can bring it up, but like have kind of a spiel that explains your overall experience. And then you can say, like, "I'm really interested in medicine because this one time something happened with this patient. I was supposed to do this. I did this, and this is what happened." And you incorporated that into just tell me about yourself. This method works really well. And that's why you need those 2 to 3 experiences, that you can use for this example. Um, so this is common interview questions. I also have, let me share I'll share another link, but this kind of has a list of every question you might encounter. Oh, wrong one. Every question you might encounter in a residency, for residency. I'll also put this in the chat, but just kind of look if this is a good thing to look for. This is also probably what's going to come up with these alternative licenses. They're very similar. They'll ask about your like, your experiences and at IMG, where you went, why did you go abroad? Or if you're an American, why you went abroad. But if you're from another country, why you immigrated into the US. Um, just to figure out like how to how they just want to get this is how they get to know you. So I think this is a really good link. I've used this before. I've shared it with others. Um, just a good way to get an idea of what is it that you should be prepared for. All right. So common questions. So the first one is always going to be tell me about yourself. And I hate this question because it's so vague, but it's just the way to kind of open the conversation and then they can ask follow-up questions. So try to keep it about 1 minute. Explain your path into medicine. So an example I give is that I'm from born and raised in California, and I had the opportunity to go abroad for medical school and took it. Then, after graduating medical school, I was involved in research, worked at the CDC, and then COVID hit, and I got the opportunity to work as an assistant physician, which only strengthened my resolve to become a physician and a practicing physician and pursue residency. Um, and then I talk about outside of medicine, what I what I like. So people talk say they like hiking or um traveling. Like I always bring up Harry Potter because I think that's a little that stands out and people are a little afraid to like talk about things that personal because they might be judged. But something unique that then again they associate with you and it'll be like it's a good conversation opener. Like I know one person, they did boxing from childhood and when they got into resident when they had their residency interview, their residency they interviewed with and got matched with, they did not talk at all about their medical experience. They ended up the entire time talking about their boxing because the program director was also a former boxer. So these kind of things are, again, see, that was something that made them stand out and made them like them, which you can also do in networking. Um, in residency, you'll definitely be asked why this specialty, um, and then why this program. So again, when you research those programs, that's where you can bring that in and then talk about, and that makes them understand that you know who they are, and you're not just, desperate to just go anywhere, that you actually are carefully considering them. They'll say give an example of being a team leader, or player, and or something about team dynamics, because you'll always be working on your team, especially in medicine. Um, and then the last two is your strengths and weaknesses. So your strengths are really easy because it just talks about what you're good at. But your weaknesses, what you need to do is not just talk about something that's not too big of a weakness that would be something that would make them worry about hiring you. But to you need to have a weakness where you said, this was my weakness, this is what I'm weak at, and this is what I've grown, like done to make myself better and turn that weakness into something that you've learned from and gotten better after learning. And because that is really important. It's not just about repeating mistakes. It's about showing that you identify where you need to work on and you're actively improving yourself there. Okay. Anybody have any questions about interviewing? No questions? Okay. If we don't have any questions, do you have any brave volunteer that would like to answer any of these questions using the STAR method? Okay. I would like one person possibly. Okay. Hannah, do you want to try to answer the weakness question and then I can give you my example?
Um, Thank you. I think I had an interview last week,
Uh-huh.
and the interviewer asked about my weakness, and I said because I don't have for now I don't have any experience with the system, the local system like EMR. For example, the Epic. I don't have any hands-on experience about Epic, so I may need more um, training or learning about that system.
Okay.
That
That's a
that's
good,
my answer.
yeah, no, that's fine. And I think that's a good start. So the way to answer that is you can use a star method, like you can talk about an example. So like, and something that always comes up for most people is poor exams, you know? So you can say, well, weaknesses that I have is I have really bad test anxiety. Um, like, so you can see how I do this and then apply it to yours about experience within the American system. So you can say that I have I've struggled with test anxiety, but because of that, my first USMLE, my score was not high enough, or you could say, or if somebody had an attempt on their first one, and then what you did is that this was a like having a especially failing USMLE is a big shock for a lot of people. So then you have to talk about how you overcame that. So that was by, trying and going back and reviewing, reaching out to people around you that helped you understand the test better. You realized you didn't give enough time to studying, so you made sure to block out more time and you changed your approach to studying. And then eventually you retook the exam and had a high score. And in the future, um, when you take exams, you are now going to consider the fact that you probably need more time than others to overcome your anxiety. So that's why you have now a dedicated approach and you're giving dedicated time to these exams to be able to pass it. So that's an example. So like if you're saying for your Hannah, for your example where you don't have experience, you can say, I've had the privilege of working in another country, but I realized that it doesn't translate directly here in America. And so I've been looking for clinical experiences to help me adapt to the medical system. And I realized this is one of the biggest issues in me getting into residency, or why I'm looking for a clinical experience position. So my approach now is to learn more about the American system but also use my knowledge from my own experience to help improve the systems here. And you can give an example, like some people talk about um, how they helped with like improve processes at a clinic. Like, it was more efficient. They made it more efficient, or they saw more patients because they learned this in medical school versus this. Um, The thing about weakness is always find a way to spin it that you got better and now you're doing really well. It's that because that shows that you're learning from it and you improved yourself, which is more important than what actually happened. Does that make sense?
Okay. Yeah, thank you. Thank you so much for that.
No problem. Anybody else have any questions or a specific question that stumps them that they probably would like help with? Okay, well, if not, think that's it for today. I know I went through three very important things and kind of quickly, but hopefully you've come out understanding the basics of how to succeed and whether if it's going through an alternative medical license or applying for residency. The biggest thing again, networking. Whatever opportunity you get is to network, especially for residency. Um, and then whatever experience you're gaining, you can always spin it into an example to use for your residency application or any other application you have for alternative medical licenses, showing your interest and engagement, continued engagement in the clinical environment and the medical field. Um, you're learning and improving yourself and gaining valuable experience. and then using that to create personal relationships with professionals in the field that can advocate on your behalf to get you where you need to be. That's really the thing. Again, like I think everything is great. You guys will all are all qualified, um, good physicians, competent physicians, but it's about translating that during the interview. But sorry, no, it's about first getting that experience. Then while you're in that experience, engaging and networking with people around you to get those interviews. And then finally, during that interview, explaining yourself and giving your presenting yourself in a way that they want to hire you. All right. Well, good luck to everyone. And that's it. I'll stay around if anybody has any questions. But that's it for today. Thank you.